Hello and welcome to this episode of The Heartbeat, the NHS North East and North Cumbria Integrated Care Board's official podcast channel, giving you the latest health news, stories and innovations from across the region. This month we are discussing maternal mental health in support of Maternal Mental Health Week. This week is all about raising public and professional awareness of perinatal mental health problems, advocating for women and families impacted, changing attitudes, and helping people access the information, care and support they need to recover. Now, joining me here today is Ange Broadbridge, who is the VCSE Maternal Mental Health Services Project Manager at the organisation Ways to Wellness. And together, we will be looking at the importance of maternal mental well-being before, during and after pregnancy. So, Ange, tell us a bit about yourself. What was your journey? How did you get to working in a maternal mental health services position within Ways to Wellness?
Oh, thank you. So Ways to Wellness is an innovation hub, and we tend to work on health inequalities challenges, so bringing people together to work on issues that are really important to people across North East and North Cumbria. And I came at this work as a mum with lived experience of maternal mental health issues myself. So when I saw the post advertised, I thought it's really brilliant to get the opportunity to work on a project and to lead a project that will really make a difference for women who find themselves in the position that I found myself in not long after my daughter was born. I became quite acutely poorly not long after she was born, really, and it took me a long time to recover up until the point where I went back to work from maternity leave and felt like I was able to find my own identity again, I suppose, as someone in the workforce, as a mother and as a wife, and a friend and a daughter too. So I think it's a role that's really rewarding. It's been a real opportunity for me to take something from that lived experience that I've had and bring it to a role where it very much is about being able to understand the challenges that new mums face.
In terms of, I guess, your personal experience, what sort of what did that almost look like? What was your journey through that side of things?
Yeah, I suppose not long after my daughter was born, I became aware that I just didn't feel like myself. So I suppose I'd been somebody who had been quite career focused and was moving into a very different experience, I suppose, of being at home with a new baby, and felt that I had lost my identity, really, the kind of things that I knew about myself as someone in the workforce and someone very productive suddenly felt and looked very different at home. And I remember just being really aware of kind of looking at the clock and thinking, how am I going to get through each day, really? So I think found myself in quite a low place. And I think what I found really supportive when I did finally speak out and ask for help. And I think one of the things that we really acknowledge on this programme of work is that quite often it takes women some time to reach the point where they feel they can ask for help. I found myself in a really supportive offer of therapy, which I went through a couple of times. I think my experience the first time was that I probably wasn't hugely honest with the therapist about how I was feeling. I think we see that on this programme of work. A lot of women have that experience of feeling that they can't be honest about all of the things that they're feeling. There's a lot of fear for women around how am I going to be judged for that? People are not going to think I'm a good mum or think that I can't provide all of the things that my baby needs, or I can't be there for my baby. And I think when I returned to work, I had that sense of my identity starting to come back, really, and I started to develop a bit more of a sense of myself as a well-rounded person, both as a mother and a kind of productive worker, and things really improved from there. And I guess I kind of took that experience and started to set up a group, a peer support group in Newcastle and Gateshead for mums. So I had some experience of, I guess, my own experience, and then working alongside women in the community and some of the similarities, I suppose, in terms of the fears and the challenges that they encountered. And that's something that I feel I've been able to bring to this role in piloting and testing something new across North East and North Cumbria.
If we're sort of like looking at Ways to Wellness then as an organisation, what sort of ways is the organisation working to improve maternal mental well-being? Are there new strategies and ideas being brought forward and that sort of thing?
Yeah, for the last 2 years, we've been prototyping. So we've been looking at what works and taking a real test and learn approach around maternal mental health. The vehicle that we've used is social prescribing link work. So social prescribing link work is about what matters to me. So we work with mums one-to-one to explore all of the kind of issues and challenges that they're dealing with, quite often their social and very practical and emotional needs. Work together to develop a plan with the link worker to support the mum moving forward and to connect them to the really good things that are available in communities. And some of those things might be statutory services, but also some of those things might be community supports, peer support groups, food bank, baby bank, those types of social supports that are available for people. It is very innovative. I guess social prescribing link work has been something that has been working around general practice for a while now and around kind of physical health conditions. For this project, we get referrals from midwives, from health visitors and from GPs around maternal mental health, and we work with women throughout pregnancy and up to baby's second birthday, women with mild to moderate maternal mental health needs particularly. And I think a real kind of benefit of testing and trying something new has been that we bring the link workers together once a month to explore the kind of gaps and opportunities and kind of new ways of working, I suppose, that can be really supportive for mums and share learning in that respect. So it is very much a programme of work with learning at the heart. And I think we've been able to pilot and test that work in 4 areas of the North East and North Cumbria. So we're working in Sunderland, in Middlesbrough, in North Cumbria and Northumberland. What that means is that it's been a very place-based way of working. So we've been able to see that what works and what's needed in Sunderland will be quite different from what's needed in Middlesbrough, where we've tended to take more of a focus in Middlesbrough around working with minoritised ethnic communities, for example. So we've been able to have that real opportunity to look at a breadth of maternal mental health needs across very, very different and diverse groups of families.
What are some of the common challenges that mothers may face either during or after pregnancy?
Well, we know that 1 in 5 women will have an experience of maternal mental health needs, and I think there's a well-published stat that 70% of women will either underplay their needs or underplay the severity of their needs, really. And I think again that very much comes from a place of fear of being seen not to be coping or not to be a good mum. And there's a very real fear in a number of women that we work with that saying that they have a challenge around their maternal mental health may result, for example, in their children being removed. So I think there's work to do to overcome a lot of that stigma. But I think in the main, there are a number of maternal mental health challenges that can come up during that perinatal period, either through pregnancy or up to a couple of years after baby's birth. Sometimes that's about postnatal depression and anxiety. Sometimes it can be more severe experiences of mental health need. Some women have had a previous experience around mental ill health, and for some women it's something that comes on quite either kind of during pregnancy or postnatally. And it might be their first experience of ever having had a mental health challenge generally. So, if you've never experienced depression before, suddenly having those feelings of feeling really quite low can be really very frightening and really quite isolating. On the more severe end of things, there is a symptom of postnatal psychosis, which is much more of a medical emergency. And I think the thing that we would always say around that is that if a new mum experiences things that feel very unusual for them or seem very unusual to family or friends, that is something that would be needed to follow up really quite quickly. And I think one of the things that I said earlier is around sometimes it can take mums a bit of time to sort of work through things, I suppose, and feel that they're in a position where they can ask for help. So I think that anything that we can do through awareness raising to support around the stigma around maternal mental health is so important, because it's 1 in 5. It is actually a relatively common experience, and it's also when women get the right help at the right time is something that is very treatable, and women do recover. So I think it's really important that we focus on those stories of hope too.
Looking at the stigma that, say, 1 in 5, 1 in 5 mothers obviously go through or has some sort of experience like this. But there is, as you were saying, there's this stigma around coming forward and actually asking for help for fear of being judged or themselves feeling like it's that they're not doing their job right, basically, or something like this. How do we, as a society, almost, how do we change that stigma, so we counteract that stigma so that mothers don't feel that sort of stigma in their lives when they're having these experiences, and it's somewhat normalized that it can happen, and it's okay if it does. There is no judgment. How do we change that societal view, shall we say?
Yeah, I could hear one of our link workers saying they just want to meet other mums, and quite often that is something that women are experiencing, loneliness and isolation during that time, and they want to meet other mums who have similar experiences to them. So I think peer support opportunities are a really great opportunity for us to be sharing those stories of hope, that women can and women do recover following postnatal illness, that there shouldn't be a stigma in asking for help, and that help is available for women, and that they will be able to move through that. I think sometimes that's about family and friends being able to be that encouraging person in the background to support and encourage women to come to ask for help, and to perhaps help them to explore some of those opportunities for help as well, and making sure that all of those resources that we know are really valuable and vital to women are available to all women. I think one of the things that we can't underplay is that in asking for help, that really can open the door to really positive experiences of hopefully, starting to move forward positively quite quickly. We would always say that women should make the most of the contacts that they do have. I guess one of the things to say is that women are very, very visible to health services during pregnancy and in that period following birth. So they have that visibility with GPs, that visibility with midwives, with health visitors, that if they have that trusting relationship with those professionals, that's a really great opportunity for a springboard for conversation. So that's about making the most of every contact that women have with health professionals, so that they do, they're asked about their mental health and they have an opportunity to share how they're feeling. And again, I think going back to that kind of first point about peer support, we really can't underplay that opportunity to be with other women who've had similar experiences in a carefully facilitated group, so that they have that opportunity to be able to take some of the stigma out of that and see that there are other women that are having similar experiences to them, that are like them, and who are able to come together and support each other through that too.
Yeah, absolutely. And I mean, in terms of families, maybe partners or family members of a new mother, for example, who might be sort of seeing this secondhand, what sort of things do they need to look out for in terms of to support, or what can they do to help in those moments where, say, in a case of a woman's maternal mental health is not well, for example?
I think sometimes in that kind of postnatal period, we can be really wrapped up in our babies, so we don't always know that we're maybe as unwell as we are. So I think family and friends play a really vital role in being able to be that person that can recognise some of those signs and symptoms, whether that's kind of increased irritability, or it can be that kind of feelings of hopelessness, or just not interacting with family and friends in the way that women might usually do. Sleep deprivation has a really big part to play there, so trying to have those opportunities to rest when you can, really, really important. And if family and friends can be supportive of that, that's something enormous that they can do to be supportive and to help. And then, if somebody is struggling, I think being that voice around encouragement to seek help is really important. And I think, as I said earlier, sometimes it can take women and families some time to reach a point where they feel comfortable to speak out and ask for help, but there are a number of resources that they can use for signposting in that respect, and a number of resources that women can use through organisations like the Pandas Foundation, a national organisation who have a helpline where they can access some support to frame what might that conversation with a GP look like, so that when they go into that conversation, they're a bit prepared around how they're going to share how they're feeling, and have that opportunity to prepare for that appointment if that's something that's needed.
Yeah, absolutely. I was going to go on to sort of what sort of resources are out there for anyone in this position to use if their sort of mental health is not well during the sort of maternal period, before, during, or after pregnancy.
Yeah, so from that kind of social, practical and emotional support, we have services in Sunderland, in Middlesbrough, in North Cumbria and Northumberland that are supporting women with that one-to-one support need. There are equally a wealth of peer support groups that operate across the region that women can connect into. I mentioned the Pandas Foundation. They offer a helpline that's available for women through a good part of the evening as well, which in that period where you're feeding your baby, having that opportunity to reach out and to ask for some help and support during that time can be really invaluable. And then there are national organisations like the Maternal Mental Health Alliance that have a lot of information and signposting on their website for women to be directed to. I touched a little bit earlier on postpartum psychosis. The Association for Postpartum Psychosis has a fantastic website and resources for women and families if they have an experience. And I suppose one of the things I would say is that it's quite rare for women to experience that severe maternal mental health experience, but they're an organisation that are there to help families through that every step of the way.
If somebody found themselves in a similar position to yourself, what would your message be to them, knowing what you know now and from your experience?
Absolutely, to speak up and ask for help, and to ask for that help as soon as possible. I think we're all doing a lot of work behind the scenes to really remove the stigma around asking for help. Women will be met with a supportive voice if they go to their GP, their midwife or their health visitor. There are services there that are there very much to welcome women really warmly and to provide that support to help them move through to recovery. And I think that's such a powerful message, that we do recover from maternal mental illness. We move forward through life with our families in lots of positive ways, but that absolutely starts with asking for help.
Asking for help, key message there. Gotcha. And then sort of looking at ways to wellness, and you described it as a innovation organisation as well. I'd love for you to sort of just talk about some of the innovative ideas that are currently going on, and any sort of future projects that might be potentially in line as well. It'd be fantastic to hear about.
Yeah, so I really enjoy working in that innovation space. So we've been delivering this maternal mental health project for the last couple of years. Prior to that, we've been delivering support for people around long-term conditions in Newcastle, again with a social prescribing framework. We have a number of projects that are working across the North East and North Cumbria supporting families. So we have a space pilot which is around child neurodisability in Newcastle. And we have another project working, Prosper, which is around pain, supporting people around their experiences around perioperative surgery. And I guess in that sense of health inequalities running like a golden thread through all of the work that we do. That work is very much about those social determinants of health, and being able to offer opportunities to bring people together to explore health inequalities, and through innovation to be piloting and testing really exciting, innovative opportunities for people to experience better, positive health and well-being. Yeah.
And I take it if people want to find out more, they can Google Ways to Wellness and see all the great work that's going on there as well.
Yes, visit our website and our social media links too.
Can you share any sort of personal stories from any women, mothers that you've worked with in your role?
Yeah, there are a couple of things that I've drawn out, and I think it speaks to that picture around stories of hope. The first quote is from a mum that we supported on the project. So you're the first person to actually ask about me and not the baby. I love them, but no one seems to think about me and what I want. And I think so often the support that's in place, there is that kind of sense that the baby is at the centre of all that. And yes, the baby is very important, but mums tell us all the time that they need to feel really important within that picture too. So I think the strength of the link work offer has been the link worker being that person that's by the mum's side right the way through their experience around maternal mental health, and being able to bring that focus on mum's mental health is really important. And the second quote is from another lady supported mental health isn't always about being at rock bottom, it's about stopping it from getting to that. And I think there's a real preventative message there that, the support is available. If you can ask for help, you will be able to be supported and move forward, and women do recover. So I think there's a real message of hope to share there.
Thank you for listening to this episode of The Heartbeats. You can stay up to date with all of our content by following the North East and North Cumbria Integrated Care Board's YouTube channel or Spotify channel. Stay tuned for the next episode.